Welcome to Flip Your Script, the vodcast from the American College of Lifestyle Medicine that's all about clinicians redefining care through lifestyle medicine. I'm Dr. Padmaja Patel, President of the American College of Lifestyle Medicine. I'm board certified in internal medicine and lifestyle medicine and currently serve as Chief Medical Officer at Nudge Health. In just around 15 minutes, we'll bring you 5 key takeaways from leading experts, innovators, and practitioners who are using evidence-based lifestyle medicine to transform patient outcomes. From practical strategies to success stories, we focus on the how of lifestyle medicine to empower you to make an impact in your practice and beyond. In this episode, we are honored to be joined by the leaders of ACLM's Sleep Member Interest Group. Dr. Hasnaa Jalou is a pediatric pulmonologist and sleep medicine specialist dedicated to caring for children with chronic lung conditions and sleep disorders, often extending support to their entire families. With a deep commitment to promoting healthy sleep, her clinical interests include narcolepsy types 1 and 2, sleep disorder breathing, and positive airway pressure management, particularly in children with obesity, Down syndrome, and genetic conditions. Dr. Michelle Jonelis is board certified in sleep medicine and behavioral sleep medicine. Her clinical focus is on non-pharmacologic management of sleep disorders using techniques such as bright light therapy, circadian rhythm optimization, lifestyle medicine, and cognitive behavioral therapy for insomnia. She attended UCSF and Stanford for her medical training. Dr. Hnin Lwin is a board-certified internal medicine physician. In her practice, Dr. Lwin focuses on comprehensive adult care, addressing a wide range of health concerns such as diabetes, hypertension, and sleep apnea. She's known for her patient-centered approach, emphasizing preventive care and personalized treatment plans to enhance patient outcomes. Well, thank you to the 3 of you for coming on again today. How are you guys doing? Great. Thank you for having us today. Wonderful. Great. So, Michelle, let me start our conversation by asking why sleep health is important and how it impacts our overall well-being.
Yeah, so we used to not know why people slept. We thought it was kind of this waste of time mystery. And then in the 1950s, people started looking at sleep. They put electrodes on people's scalp and said, "What do we see?" And we realized, oh my gosh, there's all this stuff happening during sleep, right? It is not just the brain turning off, right? The brain is doing different functions that it cannot complete while we are fully online, if you will. So, it's replenishing its energy stores. It is consolidating memories, figuring out what needs to be remembered, what can be forgotten, what needs to be paired with other information. It's tuning our cardiovascular system, tuning our immunologic system, right? Our immune system, growing for kids, right? There's all of these essential functions, calibrations, if you will, that happen during the night. And we know that in order to function optimally as humans in the world, we need to have this time to do these offline functions. And so the message started going out to the public, hey, maybe we should pay attention. This thing isn't just a waste of time. We need to prioritize sleep. We need to really have healthy sleep habits. And all of that messaging was fantastic, right, in terms of creating this awareness about the importance of sleep to our overall health. However, there is one problem, is that like with many things, we've kind of gone a little bit too far now. And the main issue is that we've portrayed sleep as this thing that we have more control over than we actually do. So it's, like sleep exercise, but we don't actually have control over the sleep. We do have control over our habits, which is creates healthy sleep, but the sleep itself is this passive, very primitive, essential biologic function, like the heart beating, right? Like we don't have control over whether our heart beats or not. We can lower our resting heart rate with, exercise and keeping everything healthy, or we can, not do that stuff and have resting tachycardia. But we can't control the beating of the heart itself. So it's the same with sleep. We can't control the sleep itself, but we can control the inputs. And so I think what has happened with this very well-meaning, very essential messaging is that now we have created a second epidemic. Before, the epidemic was sleep deprivation, insufficient sleep, people not paying attention to their sleep. But now it is insomnia, or insomnia symptoms, where people are trying to sleep. They have the opportunity for sleep if they're lucky, right? They're doing all of these things, but they can't sleep because they have the illusion of control of something that they can't control. And that makes them anxious when the sleep doesn't come as they want it to, right? When they can't control it. And then the anxiety about sleep increases sympathetic nervous system activation, which makes sleep ever more elusive because we don't sleep well when we are feeling anxious at night. That's supposed to be an adaptive response to stress, right? When we feel under threat, our sleep is lighter, we sleep less. So I think that one great thing about the ACLM that we can do is really just provide good guidance about what does matter for sleep and, what we can't control, what we can control and what we can't control, and telling people they need sufficient opportunity for sleep, right? You don't want to work shift work. Ideally, if you have control over it, is not going to be ideal, sleeping at the same time, having enough time, but not necessarily too much time. And then what happens in the night is just a byproduct of kind of everything else in our lives. And so the more healthy those things are, the better the sleep is going to be. And then also educating people about what normal sleep looks like, which is, it is normal to wake up during the night. Wakefulness is actually a normal, essential, healthy part of sleep. And I think that really needs to be emphasized. Again, when we're stressed, the sleep's going to be lighter. We can do some techniques to help relieve the stress before bed and during the night, but ultimately there's going to be more wakefulness during there if you spend the same amount of time in bed. Keeping a regular wake time is really important. There can be a little flexibility in the bedtime because we don't sleep the same amount every single night. There can be some variability. And then our sleep changes as we age. People also don't understand that. And it's really important to understand that there are changes. There is more wakefulness. The sleep gets lighter. These things are a healthy part of aging. We don't need to sleep as deeply, so we can have a little bit more of awareness of our body and of the environment, and that can actually be okay. So I think it's this fine line of the right messaging, right? The things we can control, the things we can't control, and then understanding the normal spectrum of what sleep looks like and how it kind of changes with all of these inputs.
Yeah, well, thank you. I love this answer because it's so important to clarify what is in our control versus what is not in our control. And I can tell you from my personal journey, I've been guilty of not paying attention to this pillar until actually I became a member of ACLM. I really didn't think sleep was all that important. So yeah, this is really sort of life-changing. It makes such a big difference for sure. So, Hnin, let me ask you, what are effective strategies for screening and diagnosing obstructive sleep apnea, which is quite a common medical condition for primary care clinicians?
So yeah, like when I see these patients who are at risk for obstructive sleep apnea, it's kind of like very vague because the symptoms that they're presenting is very like not specific. The common symptoms that they would say is like, oh, I'm feeling very like fatigued throughout the day. Along with that, they'll have things like, I'm sleeping well. I feel like I'm sleeping well, but when I wake up, I don't feel like I'm getting enough sleep. I'm tired throughout the day, very drowsy. And then I'm waking up with these like choking, gasping air episodes. And then the scary part is like their partner is noticing like, oh, stopping their breathing throughout the night. The having like things like, memory issues, mood changes, and they're waking up with like morning headaches, and then their blood pressure is like very hard to control. They're on like multiple medications and they're not getting better. And along with those symptoms, and then when you're like doing the physical exam, you'll be like, okay, so they have like some narrow, crowded, overcrowded airway. And when you look at them, like, oh, they're obese. And then the other thing that you can actually measure is their neck circumference. So for men, it's greater than 17 inches, and women is greater than 16 inches. So when you see these people, you can also do the questionnaire, which the one that we typically use is called STOP-BANG, which is the acronym STOP-BANG. So are they snoring? They tired? The observed sleep apnea episodes. Pressure, which stands for the hypertension. BMI greater than 35. Age older than 50. And then the neck circumference measurement. And then the G being the gender, male. So people who score like 0 to 2 is low risk for obstructive sleep apnea, 3 to 4 is intermediate, and 5 to 8 is high. So when you see these people, you're like, okay, they have the increased risk for obstructive sleep apnea, right? So I'm going to test them. So the diagnostic, the gold standard is the polysomnography. You can also do the home obstructive sleep apnea testing. So what they're looking is the number of stopping breathing episodes like per hour. So when the patient is stopping from like 5 to 14 episodes an hour is like mild sleep apnea, 15 to 30 is moderate, and then severe will be like more than 30 events per hour. So yeah, like that's how we would be like screening and diagnosing the patients for obstructive sleep apnea.
Wonderful. Thank you.
Mm.
Hasnaa, let me talk about children and their screen time. So how does excessive screen time affect their sleep patterns and overall health?
Thank you. That is really a great question. And as you all discussed, sleep is crucial. And in fact, as we know, it's one of the pillars of lifestyle medicine. And I believe honestly that sleep is not just one of the pillars for good health, but it's actually the foundation of optimal health and well-being for all of us, not just for children. More particular in children, so excessive daytime sleepiness, lack of sleep, sleep disturbance, poor academic performance, or can be the consequences of excessive screen time. And in fact, studies have shown that the more screen time, especially like before bedtime, or at that time, especially like if you have like screen time more than a couple hours around during the night, that actually will impact their sleep significantly. And not just their sleep, but some study also suggested that it has a significant impact on their mental health. And a lot of study, as we know, have shown the association between short sleep duration and obesity, which we know the impact of that on our sleep apnea, as Dr. Lwin discussed earlier. So excessive screen is really detrimental for our children, not just for our children, even for us as an adult. And the American Academy of Sleep Medicine, the American Heart Association, they all vote against having TV or electronic in the bedroom and its impact. I see Michelle shaking her head, its impact on our sleep. So like the best thing you probably want to do is promote no TV, no electronics in the bedroom for your children for sure, but even for yourself and your spouses. So I think there has been some studies suggesting that eliminating screen time before sleep, at least for few hours before our bedtime routine and what have you, has been associated with improved health, mental health, and daytime functioning in children. The studies are a little bit controversial, but they definitely show a more positive response to better health and outcomes in our children.
Nice. Thank you for sharing that.
Yeah.
Michelle, what advice do you give to your patients about lifestyle changes that can help improve sleep health and hopefully reduce the risk of conditions like obstructive sleep apnea?
Yeah, so great question. And I actually started my own clinic based on this whole idea. So I did training in neurology, and then I did just general sleep medicine fellowship. But during my sleep medicine fellowship, I had the opportunity to learn behavioral sleep medicine. I was just one of a few people who was chosen to do this, where you learn psychology strategies to manage insomnia. And the gold standard treatment for insomnia actually is not medications. It is cognitive behavioral therapy for insomnia. And, I was very nervous about doing this. I'm not a mental health professional, but then in my training, I sort of learned how to do it. When I went into private practice right after my fellowship, I started tentatively doing this and was just stunned by how effective it was and how people got better. And when it comes down to it, cognitive behavioral therapy for insomnia is really about getting people to make changes to their sleep habits and to the way they think about sleep that improves, their insomnia. It fixes their insomnia. And so I started to think about kind of like, how else can I use these same strategies, right, to help other medical conditions? And with sleep apnea, I also realized early on in my sleep training that it's a breathing problem and a sleep problem, but really it is a lifestyle problem. The vast majority of people with obstructive sleep apnea are overweight or obese and have unhealthy lifestyle factors, like they're unable to exercise sufficiently, their dietary quality is poor, and that really for these people, it's great to put them on a CPAP machine. We need to do that, right? And now perhaps a GLP-1 medication as we evolve. But if we don't address these underlying lifestyle factors, we're sort of missing the root cause of the problem. So ultimately, I heard about lifestyle medicine, decided to become certified. I'm very thankful that I did that. And then from my other private practice, which was not my practice, right? I was just in there with somebody else. I decided I'm going to start a clinic, and I called it Lifestyle Sleep. And it's the idea of using lifestyle and behavior change as the primary means to treat not just insomnia, but all sleep disorders. So hypersomnia, people who are too sleepy, insomnia, not sleepy enough, obstructive sleep apnea, restless leg, really any sleep disorder out there. Parasomnias, lifestyle factors are a huge part of the underlying cause. And so my goal is to address those. And it doesn't mean I'm not going to use a CPAP machine when it's appropriate, of course, but we are also going to be tackling diet. I use a coaching team, right? So we help them with their diet and exercise. And we know even with sleep apnea, even if they don't lose weight, if they just have an improvement in dietary quality and exercise, it actually does improve their sleep apnea and improve their symptoms, whether or not they're on a CPAP machine. So these things are really important. And again, sometimes it's a standalone, right? The sleep disorder resolved. Sometimes you need to use some other tools as well, but it's really can be the foundation of your practice. And that's why lifestyle medicine is so powerful for all aspects of health. And I love doing it.
Awesome. Hasnaa, would you like to add anything about what advice do you give to your patients, especially about lifestyle changes and to improve their sleep health and overall health?
Yes, that's an excellent question, because in children, I'm not just talking to the children, I'm talking the family as a whole, right? So we emphasize on, I don't like to call it diet, I actually call it a healthy lifestyle. That's why when I was introduced to lifestyle medicine a few months ago by a friend of mine, it was like an aha moment for me, because I'm already practicing this. In my practice, I'm applying the principle of lifestyle medicine in my patients and their families. So usually we talk about healthy choices in their diet, eliminating, high, caloric intake, carbs, and what have you, and then emphasizing with them on exercising on daily basis. You'll be surprised how many kids they don't even like play outside. Of course, there are some family who don't have safety in their neighborhood that they are not able to do that. But we talk about different practices that they can do. Like I show them like Zumba for kids on YouTube. I show them like walks, and I ask the family to work together to have like a time and exercise about 20-30 minutes a day, every day, 5 times a week. And I tell them this is prescription, this is a doctor orders, and they excited about it. And then we pick one thing and we try to eliminate that one thing. It could be pops, it could be peanut butter and jelly. Like I had a patient who eats a whole loaf of bread with peanut butter, so we eliminate that. Like I work with them closely to do one thing at a time, and you'll be surprised. And I motivate them a lot, because obviously I do use a lot of PAP therapy in my patients to treat their obstructive sleep apnea. So I motivate them, because we know like 10% of weight loss will improve their sleep apnea significantly. So that it's really the motivation, because my kids my teenager and young children don't want to stay on CPAP or BiPAP for the rest of their life. So that's a great motivation for them. So we talk about, like I said, the healthy lifestyle, exercising, avoiding screen, getting better sleep. Thankfully, we don't have alcohol in children, but we eliminate caffeine. You'll be surprised how many kids don't think chocolate milk it has caffeine in it. So, or even the family. So we talk a lot about these modifications, lifestyle modification, and that's why I love lifestyle medicine. And I'm hopeful that I will become certified one day and really try to push it further in my practice. I'm very excited.
Yeah, and I just wanted to jump in too. I agree so much with everything you said, and the way I think about the pillars is almost more like a wheel, right? Like everything is interconnected to everything else. We've mentioned, of course, diet and exercise, but all of the pillars are so important. In a lot of my older patients with insomnia, the number one cause is actually social. It's social isolation. When they are isolated, their brain doesn't feel safe at night. It feels under threat, and that's going to increase that sympathetic nervous system activation. In insomnia speak, we call that hyperarousal at night, and that is going to make it difficult to sleep. And I spend my time literally doing social coaching. Let's get out the community center, website. Let's look at that. What activity can you choose? How can you make more social connection? It's really a fault of our society. We all know that, right? We're not designed, society is not designed for social connection, particularly in kids and in the older individuals. And so I think it's just so profound. And substances, of course, right? So many times we come to the realization, hey, I don't think you have a sleep problem. You have an alcohol problem, right? Like let's work on the alcohol and the sleep problems get better. And the stress reduction mindfulness, of course, for insomnia. For all sleep disorders, that's just a big part of it. So it really, everything is interconnected. All the pillars are so important, and you can't do one without the other.
Yeah, well said. Hnin, do you have anything more to add to what advice do you give to your patients?
Just something real quick. Like when I was looking at the numbers for how weight loss is going to affect the healthy obstructive sleep apnea. So when we're talking about okay, so you gotta lose 10% of the weight, and then this many thing is gonna reduce 10%. In my mind, it's what is 10%, right? So I was doing the calculation. So if you have a patient who's 200 pounds, and then be okay, so you need to get to 10% of your weight loss, 180 pounds. So make that a goal. So when you're doing the reduction for the AHI, the index thing, 26% reduction can give you from severe sleep apnea to moderate sleep apnea. So in their mind, I think it's better to visualize, okay, you're gonna go from really severe sleep apnea to maybe not so severe anymore. If they would lose 25% of weight from so let's say the 200-pound patient lose to go to 150, the chance of they said the remission of those remission of sleep apnea in those patients become 45%. So 45% of these patients can have the remission of the sleep apnea. So I feel the visualization might help them more motivated to lose weight. So I was oh, that's interesting, when you play with the numbers like that.
Yeah, I like that. Yeah.
And the other thing I really liked that Hasnaa said was just how personalized the advice has to be, right? There is no size fits all. You really have to take the patient in the context of their environment and their limitations, right? And personalize whatever you're recommending to them. And with cognitive behavioral therapy for insomnia, for instance, there's a very formulaic way of doing it, but you have to meet them where they are. And, whatever they're willing to start with, you just start with that, and you build trust and you build efficacy. They see that it works, and then you can get the buy-in for the other things and, problem solve how to implement them. So it's definitely, the personalization aspect is really, really key to this work as well.
Wow, I love it. Personalized prescription. I think it's a perfect place for us to end this conversation. While we're out of time, I want to thank all of you for your insights and generously sharing your passion, knowledge, and expertise. And thank you to our audience for tuning into this episode of Flip Your Script. We hope today's conversation has inspired you with practical insights on how lifestyle medicine is shaping the future of patient care. If you enjoyed this episode, don't forget to like, subscribe, and leave a comment. Stay connected with us for more episodes featuring clinicians and innovators who are rewriting the script on health, one patient at a time. Until next time, take action, make an impact, and keep flipping the script on healthcare. Thank you.